kahit 50% yung minimum pass mark, gawin mo ng 100%, di ba? Why not?
Why not, di ba?
Marami kasi nagsasabi, aanhin ng sobra, pero why not?
Oo, welcome back to my channel. O kung hindi ka pa subscriber, please do consider to subscribe. And of course, turn on muna yung notification bell para na ma-updated ka sa lahat ng mga bago kong uploads. Guys, my name is Raymond and you're Pinoy Nurse here in Ireland. And as you can see guys, I am not at home at the moment. So we are actually here in Vintage Teapot here in City Center. This is a very nice place, a very cozy coffee shop. So if you are here in Ireland and very near sa City Center, try to visit Vintage Teapot. Nakapagawa na ako ng video regarding clinical adaptation and most of you guys actually ask for RCSI aptitude test topic. And we are just so fortunate guys kasi nakapag-invite tayo ng isang collaboration sa isa sa mga nakatake na ng RCSI dito sa Ireland.
A few minutes later.
Okay guys, so we are back at kasama ko ngayon si Golda. Golda, hello. Say hi to my vlog.
Hi. Hi, vlog.
Yeah. So can you tell something about yourself sa ating mga viewers?
Hi, subscribers of Nurse Raymond. Thank you for for inviting me to your vlog.
Ang ganda niya, no?
Hi! My name is Golda and I'm a nurse here in Ireland. Nag-take ako ng RCSI exam in June 2016. Not so long ago. Pero fresh pa rin yung experience sa mind ko.
Exactly.
I've been minding a Facebook page with some of my friends, yung Filipino Nurses in Ireland.
The link is down below.
Yes, it's a very helpful Facebook page full of information about how to apply as a nurse in Ireland, what to expect, kung ano-anong tips and advices.
Bago ako nakarating dito, doon din ako nag-follow sa group nila and the people there are really helpful. Kaya in-start ko tong vlog na to because of them then as well. Yung inspiration na nila. So for today guys, what we are going to talk about is regarding RCSI. Siyempre, I cannot speak something that I don't know. Kaya si Golda nandito to give us some information. And disclaimer lang, lahat ng sasabihin ni Golda, you can see that in their website, in the website of RCSI.
We're going to actually put the link of the RCSI
Ito siya actually.
website.
Ayan.
Oh, it's there.
Okay. So, yeah. Check nyo lang yung website na yan. Ito din yung tinatawag nilang aptitude test.
Aptitude test, exactly. So, RCSI oversees aptitude exam.
Okay.
So basically, if you want to become a nurse in Ireland, there are two ways. One is the adaptation, which he has already discussed in his previous vlog, and the RCSI aptitude exam. So ano ba tong RCSI aptitude exam? Very masyado madaming mga tanong, mga katanungan. So basically, it is an aptitude exam composed of two exams. First is the theory test, and second is the practical exam.
Okay.
So yung theory test is, kumbaga para siyang nursing board exam natin. It is a multiple type choice exam, and it is taken, it is a 150 item exam.
Not too bad.
Well, yeah. So, pwede kang cancellation method kasi A,
pwede ba
B,
yun?
C, D.
Okay.
Depende sa'yo kung anong test-taking strategy mo. But more or less, so it is a multiple type choice of exam, yung theory, and you take it through a computer.
Okay. So hindi na siya yung parang paper type
No, it's
exam?
not. Click ka lang doon. And then actually, if kunyari may gusto kang i-leave na number, you can actually flag it, tapos babalikan mo siya. Oo. So, sa 150 item test, a minimum pass mark of 50% must be achieved in the theory test. Sabi 50%, diba? Pero ito hindi naman na, kumbaga, 50% lang, hindi ko na ito pag-aaral.
Yes.
So, of course, guys, this is the exact reason why we are here, why we are encouraging everybody to actually read through the website, read through the links that are given in the website.
Kapag nag-take ka na ng theory exam, yung result nito, when it will come?
Noong time namin, there were, I think, 30 of us that took the theory exam on the day of the theory.
Okay.
Fortunately, right after our theory exam that day, in-announce sa amin na everybody who took it passed. Although,
nakakahiya yan pag hindi ka pumasa, no?
Oo nga, no? Pero,
except
for, diba? Hindi naman ganun. So, actually, they announced to us na, congratulations to everybody who took the theory test this morning. You all made it. Pero, there is actually an official email that you will receive, and that it is an invitation for you to take the practical exam. So, kumbaga, next level ka na.
Once you pass the theory exam, how long yung waiting para mag-practical exam ka?
So ideally, like from previous exams that people had, it is actually a span of a week. Usually it happens on a weekend, either Saturday or Sunday. Tapos, once you're successful with the theory, the next weekend, so after 1 week, you'll be taking the practical exam.
Okay.
It is important for you to be well prepared. That's the first part of the exam. And once you are successful with the theory part, you will then proceed to the practical part of the exam. So, ano ba tong practical part ng exam? So, ito yung sinasabi nila na OSCE. OSCE. Ano bang meaning ng OSCE? So, it's an objective structured clinical examination. Even sa UK.
Pero
so,
dito RCSI, yung
actually,
but it's OSCE
OSCE
talaga.
pa din yung tawag nila.
Okay.
Para siyang, kung sa Pilipinas pa, para siyang return demonstration type of exam. So, practical. So, basically, parang role-playing. You really have to practice it in front of an assessor. Ganun siya. Medyo nakakakaba siya. Achievable naman siya.
Achievable, yes.
So,
you really just need to prepare very well.
So, the practical test is composed of 14 stations.
14.
So, basically, in my experience, I had 7 stations in the morning and then 7 stations in the afternoon. So, yung itsura talaga ng exam na to is, kumbaga yung parang moving exam natin sa college na you are given like per station, tapos may mga assessor siya kada station, and then there's a scenario, and then may bell talaga, as in like mag-bell siya, and then the assessor will bring you to the next station or to wherever you're going to be.
May checklist din sila.
Meron
like, if you did
checklist,
this
of course. There's parang yung key points for the assessor to check kung ano ba yung what is asked of you. May scenario sa exam na dapat mo siyang i-perform. So, these scenarios are not really alien scenarios. These are all nursing procedures. It's just that siguro for those of us na medyo matagal-tagal nang graduate from college, siguro medyo we just need a little bit of refresher of review kasi we have to get in touch with the ideal principles and the ideal setting, diba? So, ganun lang siya. Because we are in the new normal now, so because of COVID-19, so I've heard of like test takers na who were quarantined first when they arrived here in Ireland. So, nag 14-day quarantine sila, and then they were scheduled for an exam na parang 1 day apart lang yung theory and yung practical. So, it actually depends on what the RCSI people will give you, what schedule they will give you.
That's actually one of the reasons why you have to prepare more. Kasi kung
absolutely.
Dahil sa quarantine phase na to or sa pandemic, pinapabilis nila yung pag-take mo ng practicals, you really have to prepare.
So, of course, kasi nga syempre, yun yung new normal natin ngayon. So, of course, you can use that time to study
to review,
and prepare. Lahat ng scope and coverage of the RCSI exam are all in the website, and it's all under the preparation of the overseas aptitude test. So, lahat ng links, you will see that in the minimum background reading. Yung charts, forms ng mga ginagamit natin sa hospital, your fluid balance charts, your IV charts, even the card, there's even a sample of the medication cardex that we use in here.
Those are the forms that you usually see sa hospital setting din. Hindi na rin magiging bago sa paningin kapag chinek niyo yung mga forms na nandun.
There are 14 stations, right?
14.
So, 14.
Guys.
Parang nag-way of the cross tayo. Stations of the cross.
Yes.
Pero, after naman nun, magiging ano kayo, you will see the light afterwards.
Walang susuko, guys.
So, I'll give you one example of a station.
Yeah.
So, there's a station that is talking about a patient that is having shortness of breath. So, basically, itong station na to is you will be administering a nebulization. So, of course, yun yung isa sa mga example lang to ng na-experience ko na station. So, in the actual scenario, pagpasok mo doon, merong hospital bed, merong assessor. So, yung assessor ko was acting as the patient. And then the scenario was that the patient was having shortness of breath, and then yung dapat kong gawin is that I have to administer a nebulization. So, before administering the nebulization, of course, what I had to do was basic nursing care, introduce myself, I identified my patient. So, ganun naman, di ba? Ganun yung, that is actually
yung pinaka-basic ano yan.
Exactly. So, like, good morning, my name is Nurse Golda. I'll be the I'll be the one looking after you today. Can I have your name and date of birth, please? So, syempre, identification of the patient. Meron silang name band. They have their date of birth and they have the MRN or the serial, the number, the medical record number in their wristband. So, ganun siya. Yun yung mga basic things na dapat gawin.
What if pala,
station.
kunwari nag-rattle ka, no? You missed,
Oo.
like, verifying the MRN or anything. Can you go back?
Oo naman.
Yung kaba mo nandun na.
Yes, exactly.
Minsan may makakalimutan kang step.
Oo, totoo talaga yan. Yung kaba nandun. Pwede kang magkaroon ng mental block. Right when you're taking the exam, but do not fret. Alam niyo yung tipong yung heart ko parang
Fresh
lumalabas
pa rin.
na. Oo, lumalabas na sa scrub suit ko.
Yeah.
Talagang feel ko. Just take a deep breath. Smile. Tignan ng assessor at sabihin, oh, sorry, I think I forgot something. Can I start all over again?
Yeah.
Pwede mong i-redeem yung sarili mo. Kasi it's not
Good
the
point,
end of the
guys.
world, diba? Kumbaga, the sooner that you realize, ay, nakalimutan ko pala to. In my mind, nakalimutan mo. So, sabihin mo talaga, excuse me, sorry, what I meant to say was that. You can actually tell the assessor, sorry, can I start all over again? Wala
That's
namang
good.
masama.
Generally, guys, me being here like for 9 months, I can say that yung mga Irish usually, mga lenient talaga. Make sure na hindi ka nakaka-harm sa pasyente. Patient
naman.
safety first priority
Exactly.
talaga.
So, the priority actually in all the stations ng RCSI exam, they will always emphasize patient safety. It's
Lagi.
exactly
You
patient
should
safety.
be patient
Oo
advocate,
naman.
kumbaga.
You will really see all the links of the topics that are in the exam. Walang labis, walang kulang. Nandyan po yan lahat under test preparation dun sa website at under minimum background reading. So, sobrang
Guys, minimum background reading, pero like 30. like
more
30 things, more than
Yes.
that maybe.
Pero wag kayong matakot kasi you can read through it.
Ahead of
Maybe,
time, no?
Oo, of course,
Yeah.
exactly.
Ahead
We
of
have
time.
all the time in the world. So, kahit 2 topics per day ang basahin mo.
Correct.
All these things are very, very helpful. Yung information, as in like super rich information. So, makikita mo dyan lahat ng posibleng lumabas sa exam. Not just by the way for those taking the RCSI, but for those taking the adaptation.
Saka makikita niyo dito guys, yung HSC topics din. Nabanggit ko yan sa clinical adaptation vlog ko. Plano kasi ng Ireland is to systematize the practice. So it's really a good thing.
Siguro na-mention mo na ng meaning ng HSE before sa mga previous vlogs.
Health
So,
sector executive. Okay, so
Health,
ito,
health services.
services
executive.
pala, mali
Oo.
tayo. Cut out.
HSE is actually the one that is looking after all the medical
Regulating the policies, the
exactly.
procedures.
Oo. So,
yung
sila yung
mga
regulating body.
So magandang pahapyaw na yung mga sinabi ni Golda guys. Pero I'm sure, magtatanong kayo, may
Oo
bayad
nga.
ba to?
So, may bayad
Or libre ba to?
So guys, of course, meron siyang bayad. You will also see that under fees in the website. The exam is costing 2,800 euros. But wait, there's more! Payment can actually be paid by your employer
Okay.
or your agency or yourself. Depende sa setup po ng application nyo. Depende po yan sa setup ng kontrata nyo with your employer or with your agency.
Yeah. So bottom line guys, yung RCSI or yung adaptation, it is not our choice. It is their choice, yung employer natin. So kailangan alamin mo muna bago ka mag-commit
ganito pala.
or sa
Oo.
contract, no? Kailangan alamin mo kung ano ba iti-take mo.
Oo, so magandang
Diba?
question yan, Raymond. Kasi actually, there are people asking, Ma'am, ano po bang magandang i-take?
Yes,
Is it
oo. Marami
better
din
to take the
tatanungin.
RCSI or adaptation? Usually, your employer that will decide. If your employer is a hospital, more or less, most hospitals would opt for adaptation.
Correct.
Parang din siyang mini-induct. Pagpasok mo sa hospital, alam mo na yung mga equipments, alam mo na yung Other employers, such as nursing homes and clinics and the like, they would usually opt for RCSI exam. Kasi nga, aside from it's faster, kasi 2 weeks
Yeah, 2
lang
weeks
siya.
lang. Registered ka na kagad,
exactly.
no? Once you pass it.
Oo, tapos ang kailangan mo lang talagang gawin is matutunan mo lang yung lalabas sa exam. Both of them has their own pros and
Pros and
cons.
cons, yes.
Exactly. So, depende talaga siya.
Regarding that, I think magandang topic yan in the next few vlogs, guys.
Watch out.
So, what if you fail? Kasi
Ayan.
sabi nila, di ba, pag bumagsak, uwi ka na daw ng Pilipinas. So, what's the truth
So,
behind that?
i-discuss natin yan kasi very, touchy subject yan. Kasi nga, syempre, it's an exam, guys. Test. Talagang may kasama siyang hardship ng konti. We are changing the standard that we have learned from dito sa bagong standard. Kasi papasok tayo as a nurse dito.
Correct.
So, kumbaga, may iba din silang standard. So we have to come into terms with that. At the end of the day, they just want to see how competent we are and how confident we are going to be in order to practice our nursing career, diba? So never have I heard of a Filipino failing the theory exam. So, hindi naman sa pagmamayabang. Talagang magaling naman tayo mag-prepare.
Yeah.
Sanay kasi tayo sa mga exam. Board exam pa lang, mga RLE exam natin, lahat-lahat, di ba? From college pa lang. It's the practical that could be a little bit tricky. Kasi
and intimidating, for
and
sure.
intimidating,
No?
of course. Nerve-wracking, lahat. So, kumbaga, kailangan confidently beautiful with the heart.
Confidently beautiful with the heart.
Okay, ganun lang
Peter
siya.
words back.
May assessor, i-judge ka kung paano mong ginagawa yung procedure. Kaya medyo, medyo, yun na nga, tricky siya. So, you have 2 attempts in taking the practical exam. In the first attempt, that is the first attempt, so you have the 14 stations. First station, they would give you actually 10 minutes. But
10
I would
minutes.
suggest, train yourselves to do each station within 8 minutes. May konting time ka na, kunyari, ay, may nakalimutan ako, gusto ko tong sabihin, ganyan. So, para at least,
Allowance kang
may
bawiin yung
allowance.
sarili mo, guys.
Exactly.
Ito bang mga assessor na to, magbibigay pa sila ng hint, kunwari, you pass it?
During the scenario, for example, medyo nalilihis ka na dun sa topic na dinidiscuss mo, your assessors will actually give follow-up questions. So, hindi naman yun to pin you down. That's actually a way of them to put you back on the right track. Ay, oo nga pala, ito pala yung dapat kong answeran dun sa what is being asked of me in this type of scenario. So, hindi naman sila ganun ka-terror guide. They are really helpful. We have had assessors na Irish, Indian, and
So, iba-iba.
Filipino. Yes, just in case you don't, you're not
With the-
successful with the first attempt, i-repeat mo lang naman yung hindi ka successful na scenario. So, you will not necessarily repeat everything. So, once you don't really make it on the second attempt, so, yun yung sinasabi guys na the opportunities doesn't stop there. It's the same as all the other exams. When you're taking NCLEX, when you're taking the, ano ba tawag sa UK? CBT or all these other exams, or when you're taking the HAAD, defining moment siya in a way na syempre, you're taking this as an opportunity, but it doesn't define you as a nurse. It just so happen na hindi nagmatch yung credentials mo, or hindi nagmatch yung kakayahan mo dun sa exam, what is being asked of this.
Maganda yung sinabi mo. Very heartfelt.
So, when you pass both the theory and the practical, so automatically, you can then apply for your nursing pin.
So ngayon, ang question ko naman, kasi 2 weeks, di ba? Dito ba sa
Okay.
RCSI, are we receiving something? Or
Okay, so
are we getting paid for that?
That's one of the difference between the RCSI and the adaptation. Wala po tayong sweldo dito. However, there are agencies or employers that would offer an allowance, an applicant's allowance, by the time you step here in Ireland.
So you really have to communicate well to your agency.
Exactly.
to your
Have
employer.
a clear, open
Yes.
communication with your agent, with your employer. Okay lang naman yun. Kasi yung difference, di ba? Kasi sandali lang siya eh. 2 weeks lang siya. So, kumbaga, after passing, nurse ka na eh. You can start working right away. Whereas yung adaptation is 6 weeks?
6 to 12 weeks.
6 to 12
Yes.
weeks. So, kaya I think there's a need for you to receive a little bit of compensation. Kasi nga, mas mahaba siya.
Pag nakapasa ka ng RCSI, usually, kung ano yung pinirma mo sa contract mo, na salary grade,
Exactly.
yun yung may-receive mo.
Yun na yung marireceive
Yeah.
mo. Oo.
Sa amin kasi, pre-reg rate ka pa lang,
Yes.
and then saka pa lang siya nag-jump up to your signed contract nung nakapasa ka na. So, I think we have tackled a lot regarding RCSI. Kasi guys,
So,
ang
yeah.
RCSI is really broad. Any tips that you can give them? Any review materials or
Yes.
anything?
You can read your medical, surgical, nursing books. But I would suggest read all those links that are given on the RCSI website. The RCSI people keep on updating the website. Safer for you to actually read the links that they are giving. Mas maganda talaga yung link sa website because ito yung official.
Saka this is lined to the Irish practice talaga.
Exactly.
Kasi mga books natin sa Pilipinas, usually Americanized eh.
Yeah. Everything that you need, guys, huwag kayong mag-alala. Scope of nursing practice, all the procedures that we do na Ireland-based, nandun siya lahat sa website. Once again, thank you so much for tuning in to Nurse Raymond's vlog. So he will be posting a lot of information soon. Subscribe to his YouTube channel. It's also my time to promote our Facebook page. If you're very interested to learn more about being a nurse in Ireland, being a Filipino nurse in Ireland, just follow and subscribe Filipino Nurses in Ireland, the Facebook page. We have to screen everybody that will be going in. There are a few questions that you have to answer. We just want to make the Facebook page very organized. Kasi alam mo naman, maraming mga, ano lang, yung mga dummy accounts.
Correct. Once you're in, I'm very sure guys na very responsive yung mga tao doon, especially yung mga moderators like
Minsan
Golda.
responsive.
Like Golda.
So all of us are full-time nurses, pero we
Yeah.
try as much as we can to
And of course, yung mga
address your
members din
concerns.
yung mga members,
Exactly.
nag-reply din talaga sila.
Yeah.
So guys, lagi natin tatanda, may mga silent readers, silent viewers na nandiyan. Iniisip nyo hindi kayo nakakatulong, but really, you are a big help. And I think that's about it for today.
Oo nga.
Ito na yung topic natin, RCSI. And once again, thank you so much, Golda,
Thank
for
you.
your time.
Thank you so much.
Sa susunod ulit, hopefully.
nga.
Hopefully. And I think that's about it, guys. And thank you for tuning into my channel. And I'll see you next time.